Afternoon, everybody. I'm Toby Eccles, and I'm here to talk a little bit about social impact bonds. I think just a little bit about social finance before that. We started actually 10 years ago, which feels very strange, I have to admit. This October it was 10 years. And we sit between government, social organizations, funders and investors, really building partnerships to try and create social change. The most well-known of which, in terms of what we do, is the social impact bond, which I'll talk about a little bit more about now. So I've already done that bit, so that was easy, wasn't it? I suppose the essence of what caused us to start social finance was this sense that, if you look at any working market, it's got some kind of definition of success. Whether it's, the private sector where you've got profit driving things. If you're an academic, then what you want to do is publish in peer-reviewed journals. If you're a vlogger, then you want to get as many YouTube hits as possible. And all of these definitions of success creates market success and failure, innovation and struggle, and so on. And when looking at the social economy, what you find is actually there's two or three really different narratives defining success. So in terms of dealing with government, it's responding to tenders. In grants, I'm afraid still in aggregate, it's typically the quality of narrative and story rather than data. And to the general public, it might be building a brand. The difficulty, therefore, is actually in the social economy, there isn't any sense of unified definition of success. And you'll also notice that none of those definitions of success are actually whether you provide the right high-quality service to the vulnerable people you're meant to be working with and supporting. And that became an absolutely central theme to social finance's interest. And behind that interest in building social impact bonds was this underlying thing of how do we get the world, how do we get the social economy to think more from an outcomes point of view. The first of these types of projects, we focused on short sentence offenders. This was quite a long time ago, or feels quite a long time ago now, but it was an area of consistent and systemic failure. So here you'll see the reconviction rates for those who serve a sentence less than a year. But I've always found the number at the bottom there, that an average person leaving from a short sentence offence has been in prison 7 previous times, is an indication really of how much this is a revolving door of failure in the system to do something about this problem. And so we offered, as a way of breaking that deadlock, a deal to government, which was simply, if we can agree a value for reducing the amounts that these guys offend, and we can agree a way of measuring it, we're happy to take a contract where you only pay for the difference we make. And that simple statement, which was, in a certain sense, very hard to refuse from a political point of view, it was very exciting, gave a way of starting a conversation to allow us to set up a program, the Peterborough Social Impact Bond, the first of its kind, to build out a contract simply based on you will get paid only for the difference you make. And in putting that together, we added, if you like, a single trick. Because normally, there's an obvious flaw with an outcome-based contract, and that is that no one would be insane enough to take the other side of it. Would you like a contract working with government where you only get paid if it's successful, and that means you won't get paid for the first 2 or 3 years whilst we figure out whether it's working or not? There's not a lot of people willing to take that risk. But what we found was that there are people willing to take that risk, and they're called investors. And so by bringing an impact investment community in, we were able to unlock that set of activities, and we were able to bring service providers in to work in the prison, through the gates, out of the prison, and work with these guys right the way through to try and solve the issues that they've got in order to improve their outcomes, to reduce reoffending, and to provide, hopefully, therefore, payments to investors from government so that we end up with everybody winning. And only fairly recently, although the contract was signed in 2010, did the final results from the Peterborough SIB get announced, and we did achieve a 9.3% reduction in reoffending and a 3% annualized indexed yield for investors. So was that perfect? No. Was it a result to be proud of in the circumstances with a brand new idea and instrument? Yeah, we were pretty excited about that. Now, this model has set off a whole thing. The social impact bond has spread out. Can I just, it's quite dark in here, I know, but can I just get a raise of hands just to get a feel? How many people here have heard about social impact bonds and feel they know what they are? Blimey. Sorry, it's kind of cool. Because, you know, if I'd asked that question 3 or 4 years ago, then it would have been a smattering of fellow nerds in the corner like me. But this has set off something. It has seen something around the place that other things have not been able to solve in the same way. And I'm going to talk quite a lot about some of the difficulties of these, but the starting point has to be that there is an underlying difficulty of engaging government in innovation. And this seemed to be a way of unlocking that challenge in certain circumstances. Most of those SIBs have been in these kinds of issues, so there's quite a lot around children and families, young people coming out of the care system. There's a lot around employment and workforce. There's some around criminal justice, as you see, and around housing and homelessness. And then there's also emerging a sort of education and early years piece. And one I'm particularly excited about, although I think it's also extremely difficult. There's one in Worcestershire, which is paying on the basis of reduction in isolation of elderly people, because social isolation is such an issue for the elderly in the UK, and it's therefore, when you look at ways that we can deal with an aging population, actually creating stronger social connections and community around people is probably one of the few things that we've got that's affordable. So we've actually got the health service paying for reductions in self-reported loneliness, which I thought was a pretty unusual solution. So really, here's the way, when we set off on this journey, these are the things that we thought a social impact bond was doing. I mentioned this idea. Most contracts that you get in a government context measure your inputs and your processes. So therefore, you're told at the beginning of, say, your 3-year contract exactly what you're meant to be doing, who you're meant to be employing, how they're meant to be doing it, and there's lots of process checks all the way along the piece. And therefore, in the 3rd year of your contract, you're meant to be doing what was specified before you started. In other words, these contracts say, please, under no circumstances, learn anything, because then you might want to change something. And that's really hard. So the crux of the social impact bond start was to try to bring flexibility into the model so that we could actually do, essentially, what entrepreneurship does, which is create a learning engine, adapt, use data, change what you're doing, improve what you're doing, focus on outcomes, focus on people. And that's why the core of the model was about bringing that flexibility in to allow client-centered programs and innovation. It also required rigor, because an awful lot of programs don't measure whether they're successful. Whether that's government programs or social programs generally, there is actually, in aggregate, really poor measurement of success, which means an awful lot of money is spent without people being entirely sure whether it's doing very much good, and that, of course, puts that spending at threat when people are more suspicious, or government changes, or mood changes, or narrative changes. And you shouldn't have social programs reliant on narrative, they should be reliant on data in order to sustain them. It also builds partnerships between government, in the private sector or the social sector or whoever is providing the work. And the last bit I'll mention here, because I think it's extremely relevant in the present environment, is that they build an opportunity for earlier intervention. With the present level of cuts going on, with the level of change in government spend, one of the only things that local authorities, local governments, state governments, all around the world can be doing is trying to shift spending upstream. How do we spend money to prevent problems happening rather than spend money after they've happened? And the problem is that that prevention is very hard to sustain, because actually, when it comes to another budget cycle, and it's been happening, by the way, all over the country, is it easier to cut A, hospital beds or prison places, or B, smoking prevention programs and home help? I think we all know the answers to that. So if you want those prevention programs to be sustained, then you have to give them the data and the rigor to support them. You have to make sure that you are targeting your population well, because otherwise you are not going to see the savings benefit come out the other side, and you're not going to be able to sustain the programs on an economic basis. So I think that's a crucial element of this conversation. I'm going to focus in on just these, on two of these elements, and then I'm going to talk about what does or doesn't happen and what goes wrong. So I talked about this flexibility and this restricted learning. I think one of the things that when we started this work, we thought if you create outcome-based contracting and if you add some investors, then people will adapt. They'll learn. They'll change what they're doing. We were not entirely right. The change culture required to bring adaptation and make it normal in the social sector is a huge and ongoing challenge. The data capture required, the governance required, the consistent, rigorous look, the willingness to not drink your own Kool-Aid and to change what you're doing according to what you read is a huge change of narrative and culture for the social sector. And we have found that putting that in place has been a real pleasure, actually. You go through this cycle with people get quite cross with you early on when what the data says isn't what they thought it should say. And then actually as it comes through, they get more and more excited about it as they feel that they're improving the program that they're delivering to the people they should be delivering it to. And I think with the increased use of data science, the increased value of data, the reduction in cost of capturing data, it will become less and less excusable for people not to know whether what they're doing is effective. But doing that in a nuanced, intelligent way with contracts that allow you to adapt accordingly is a really wide challenge around outcome accountability in government, in the social economy generally. And I think it's definitely an area where impact investors should be demanding. You should be demanding around this area. It's one of the huge opportunities for impact investment to make a difference, is to be demanding in this area. And I just thought I'd give a little sense of that adaptation in practice. So in Peterborough, we had 2 cohorts of 1,000 offenders each. And you'll see that in each of the different elements that we had, you could take the data and we got this consistent improvement and adaptation because we were looking at the data elements all the time. The only difficulty with Peterborough, which was a really interesting problem, was that the actual data as to whether we were reducing recidivism or not was not measured until after the end of a cohort. And so we didn't have that data to use that to improve what we were doing. So we had to work from these proxy measures and hope that they were delivering improved outcomes. So it was not ideal. In later models, we've always focused in on trying to make sure that the cadence of the data that one's receiving is fast enough so you can use that to make changes to the program during the program and not afterwards. And this then is illustrative, but it shows how much the program changed over time. I think one of the really interesting pieces of feedback we got from the Ministry of Justice when they took over the program, they decided to make a whole national change called Transforming Rehabilitation, which I've got very mixed feelings about. But that element, when they looked at what we were now doing in Peterborough versus what we started with, the response was, we could never have procured this. There's no way we could have tried to buy this program because it shows so much awareness of what was going on locally, what wasn't going on locally, and what gaps we had to fill in order to make these guys' lives effective and to get them onto a different path. And that, I suppose, was something that made me proud that we were going down the right path. And when we've talked to other entities running or managing social impact bonds, the frontline experience is fairly consistent that actually the outcome focus has changed what they're doing on the ground, often quite significantly. The second benefit of social impact bonds, which I suppose this one we really hadn't focused on beforehand, was the benefit to government of linking national government elements or national government benefit to local action. So, for example, if you look at the value of doing good drug recovery services, the costs of doing drug recovery services reside at local government level. But only 20% of the value of doing them well comes back to local government. The remainder goes to national government departments, Ministry of Justice, Department of Health, so on. So what that means, very straightforwardly, is that there isn't an incentive to invest effectively in drug rehabilitation services locally. And we have seen really significant engagement with this issue of social impact bonds from central government, primarily around this piece, creating outcomes funds totaling over £100 million now to try and drive local activity. They haven't all been as well structured as they should have been. I think with the real focus that we've got at the moment on Brexit rather than social policy, I think they're going to disappear at the end of this Life Chances Fund now. I think it's a great shame. So, that's something I think to drive at and to focus on, because actually it is one of the very, very few levers that national government could have for creating intelligent partnership between local government and national government to drive program quality and therefore drive long-term costs out of the system in terms of unemployment costs. Mental health and employment is another great example that we've had recently, and other areas. So I think that's, when you're looking outside of the UK at other international contexts, again, federal and state in the US, again, there's an interest in the same sort of thing in Australia. I think that's a sort of long-term opportunity for this kind of structure. Things we've learned. I initially called this things we got wrong, and then I changed it because I was maybe feeling a bit shy. But I think that there's some really interesting lessons for people trying to do this kind of thing in terms of thinking. The first is that we arrived with this notion that saying to government, you don't pay for it if it doesn't work, was really exciting risk transfer. And that would be really beneficial. And that would mean that lots of people wanted to do this. It just meant we totally misunderstood what the nature of risk for someone working in government. Risk to them is trying out an innovative instrument, being left with money that you didn't spend at the end of the year or at the end of the whatever it was, having outcomes genuinely shown not to be delivered, or paying too much for something and have investors make money. All of those are big risks. So actually, the social impact bond was hugely increasing risk for the individuals on the other side of it, rather than transferring risk away from government. Oh, how naive we were. Sorry, folks, we got it wrong. What was interesting about that for us is that still people wanted to do this. Not everybody. Plenty of people wanted to do it at the ground level, and then when it got up to sort of middle senior management, there was a lot more nervousness. But I just think it's worth reflecting that this hasn't solved the risk problem in the way that we thought it would. The second, and I think the one that I find personally most depressing, is that of sustainability. We thought, pull together a program, rigorous demonstration of outcomes, and then it will happen all over the place, and lots of people will want to do it, and it will be sustained. That has not proven to be the case. So some of these were set up with innovation money, and that innovation money dried up. Others, the temptation was to try and set up an alternative path that appeared to be cheaper afterwards, that kind of thing. These have not ended up as sustainable as we thought. Now we're building new models. We're building a partnership model for working with a lot of different local authorities in London around children on the edge of the care system. There's a whole range of models, but that first bit, actually the idea, the hypothesis that demonstrating programs rigorously would lead to sustainability has not proved to be true. There are more subtleties and context to making programs sustainable with government than that. And then lastly, the whole business, we get told all the time the transaction costs of social impact bonds are high. Where I think there is a failure to understand that what one is doing is running a change management program to get a whole change of culture to focus on outcomes, at the end of which you do a transaction. And that the value of that change management has not been fully appreciated, and therefore there's a continual sense that these are expensive. I think that that's something which we have found frustrating, because also the scale of these projects has not suddenly gone up. You don't now have immediately in the UK 10, 15, 20, 30 million pound social impact bonds. And that's because actually the counterparty, which is usually local government, has only a certain scale of problem that it wants to address with this. So I think from an investment point of view, these have stayed a specialist sport for longer than we would have liked. But there is now $330 million invested in them, or $300 million thereabouts invested in them, and we are seeing the potential for aggregation over time. But those, I think, are some of the frustrations. If you want to know a little bit more about it, the social impact bonds, the early years, we produced in July last year, and I think it's still highly relevant. Most of the lessons and data in there is still very relevant. If you're wanting to invest in something, I would say that we have an unusually exciting, for my money, health intervention called Kangaroo Mother Care in Cameroon, and we also have an employment program in the West Bank. If anyone wants to talk to me about either of those, I would be delighted to do so, because of course I couldn't resist that. In terms of the future and where this is all going, I think that I see a world, if this is successful, and I think we have created something which has created a lot of momentum, but it's also created a lot of pain. These are not easy to do, because you're creating little outcome-based worlds in an input and process-driven environment. I mean, just to take an example, in the Public Accounts Committee, how often have you heard of a civil servant being hauled over the coals for failing to generate outcomes, in comparison to being told that how did they give money to the Adam Smith Institute because the chief executive was paid too much? Did the Adam Smith Institute generate outcomes in Afghanistan? I couldn't tell you, but I do know that their chief executive was paid too much. Until we change that accountability process much more widely to outcomes, these programs are going to seem and be countercultural. What we'd like to see over time, and what I'm really interested in, is how do we create little outcome markets? And that's what I'm tending to work on at the moment, is really is funds that are looking at a particular social market, and where you can bring a community of actors and payments on the basis of outcomes that change each year, and therefore sustainability is built in from the beginning. So, in other words, I think what we're seeing is moving from individual transactions to market-oriented solutions over the next year to 3 years. And as we do that, then I think the investment opportunities will become more consistent on more data, the costs of doing business will have declined, and hopefully we'll have changed the whole area's culture to being outcome-driven rather than input and process-driven. And that will lead to ultimately much better outcomes from the vulnerable people that we seek to serve. Thank you.